Exercise does so many healthy things. We're happier, we sleep better, we're calmer. All those kind of things are helped by exercise, and our blood pressure goes down.
Hello, everyone. We are back with Uncomfortable Questions. I'm your host, Cab Washington, sitting down with the weight loss doctor himself, Dr. Craig Primack. So today's episode is going to be all about blood pressure. So let's start with that. What in the heck is blood pressure?
So blood pressure is the amount of pressure your heart has to develop to push blood through your arteries.
So high blood pressure, we all know this is not good. What are some things that go into how that pressure gets high and how we overwork our heart?
There's a lot of things that we do that causes obviously high blood pressure. But then again, on the other side, there's a lot of things we can do to help our blood pressure. The first thing is thinking about losing somewhere between 5 and 10% of our weight. The second is overall eating healthy. The third would be eating less salt, getting good sleep, which we talk about here all the time.
Yeah.
But 7 to 9 hours of what we'll call that restorative, good, deep sleep, where you wake up feeling refreshed. Probably the next one would be decreasing alcohol. Alcohol has some benefits. Obviously, we do it socially, but when it talks about blood pressure, especially the next day after you drink, maybe the night before, and you wake up feeling not 100%, your blood pressure is usually higher at that point. And the last is decreasing smoking.
Yeah.
Smoking over time tends to clog up our arteries and makes all these things even worse.
So what are some things we can do to monitor our blood pressure without going to the doctors every 6 months?
First, know if you're at risk. So people, number one, their genetics and their family. There's a lot of people, if blood pressure runs in your family, it is something you should keep on mind. Or just going normally to your doctor for your yearly checkup or any checkups in between, and just having them and seeing what it is, and then talking to your physician or nurse practitioner about what would be a good blood pressure for you and what to do about it.
All right. Another factor, right? Something that we know and love, stress. Hello. How do we feel about that? And does that negatively impact blood pressure?
So number one, absolutely. Stress is not conducive to good blood pressure, but there are a lot of things we can do. The first is regular exercise, especially cardiovascular exercise, going out for a long walk, going for a run, bicycle ride, as we've talked about before, things like that. Meditation is great. There's a lot of apps, yoga, just sitting and being calm for a few minutes, focusing on your breath is a really good way to decrease your stress.
And what are some of those great exercises that get your heart rate moving? Like cardio is one of them. Bicycling is another one. What's something that maybe you can do in the office place?
You can do a lot of things. You can do jumping jacks in place.
Oh, jumping jacks.
Burpees, actually, interesting enough, and we all hate them.
Yeah.
But that being said, they have been shown to do a lot to get your heart rate up in a very fast. You can do 5 of those, even just 10 of those in between a meeting. If you're on, doing video meetings all day long and you have a 10-minute little block, that would be a great way to just, I've been sitting for an hour and a half, and I just want to do something quick. A couple jumping jacks, a couple push-ups, maybe some sit-ups or crunches, all those things. Very easy. You can do them anywhere, and they take just a couple seconds.
All right. So you hear that, folks? Jump on your Zoom, turn off your window, do some burpees. If you're out of breath, tell them that you're prioritizing health, okay? And wait. You better follow, or subscribe, because there are more uncomfortable questions coming. All right. That's all the time we have for today. Thanks for watching.